everybody. Today let's discuss about common menstruation problem, that is dysmenorrhea. It is also known as painful periods. Means they'll have pain in the lower abdomen, and this pain varies from woman to woman, and it was classified into two types of pain, that is primary and secondary dysmenorrhea. So what is this primary dysmenorrhea? It is very common because of contractions in the uterine muscle. They'll have this pain. And whereas coming to the secondary dysmenorrhea, it results from physical problems. And it occurs, this primary dysmenorrhea, it occurs during adolescence and it fades away with the age. Whereas secondary dysmenorrhea, when the age increases, the pain becomes worse. And also it lasts longer than this primary dysmenorrhea. And what are the causes of this primary and secondary dysmenorrhea? Now we'll discuss it. So what are the causes for primary? Like started menstruating before the age of 11 years. And heavy and long periods. And if they have smoking, if they are in severe dieting, and if they experience any psychological pressures like anxiety, depression, or any social isolations. These may also cause this primary dysmenorrhea. Whereas coming to this secondary dysmenorrhea, this may be because of pelvic pathologies like any conditions, fibroids, cysts, endometriosis, adenomyosis, infection, or any pelvic inflammatory diseases. So next we'll discuss about symptoms like throbbing or cramping pain in the lower abdomen, and this pain also radiates to lower back and also for thighs, and this pain is dull and it will be continuously aching. And next other is like some women, they may experience nausea, loose stools, headache, and also dizziness. These are some symptoms for dysmenorrhea. The main symptom is pain. They'll have the intense pain. And next is pathophysiology. So what's happening here? Why this pain is occurring? So what is going on in the uterus we'll discuss. So due to a chemical called prostaglandin, because of hormonal changes, there will be release of high levels of prostaglandins. So when there is high levels of prostaglandins, it makes the uterus to contract more stronger. So because of this strong uterine contractions, it can get pressed by the blood tissues. Nearby blood tissues get pressed. So because of that, it reduces the oxygen supply to muscle tissues, and this causes the pain. This is the pathophysiology. Nothing but due to prostaglandin, it is making strong uterine contractions. Because of strong uterine contractions, it is pressing the nearby blood vessels and it reduces oxygen supply to muscle tissues, which is resulting in pain. This is the pathophysiology. And next, what is the treatment? So the management is antispasmodic drugs. We are giving the drugs that is to relieve the muscle spasms, uterine muscle spasms. So like we are giving painkillers. So if the painkillers are not relieved, then we'll give some higher dose of painkillers. And if it is also not subsided by this high level of painkillers, then we'll give some oral contraceptives. This is the choice. If it is not relieved by the painkillers, then we'll give this oral contraceptives. And next thing is, you have to try this heating pads to reduce the pain. You can suggest them for this heating pads or hot water bottle. They have to apply over the lower abdomen or back to reduce the pain. This is the management. And next, coming to nursing management. So as a nurse, you can educate them to take the medicines properly and to try this heating pad or hot water bottles. And next, you can encourage them to do this exercises, yoga, and also about the diet. So they can take this anti-inflammatory foods like ginger, cucumber, cinnamon, turmeric, tomatoes and also berries. And also they can try this cup of chamomile tea. And they should avoid some sugary foods and also fatty foods. They increase the dehydration and which leads to increased pain. So they should not take this sugary foods and fatty foods. They have to avoid alcoholism and also they should reduce this salt intake. These are some general points which they have to focus to reduce their pain. This is the nursing management. I hope you understand this topic. Please subscribe my channel. Thank you.